Hello, everyone. Welcome back. I am hopeful that my volume is a little bit better with a headset. So here we are. Ah, Thank you, everyone, for all of that engagement on the last presentation. We are grateful to Susan and Statistics Canada for sharing that information with us. Our next session comes from Dr. Monique Gignac, who will be giving us an update on the job demands and accommodation planning tool, which has been evaluated in this past year. If you have attended the summit before, you might be familiar with Dr. Gignac. Dr. Gignac uses she, her pronouns and is the scientific director and a senior scientist at the Institute for Work and Health and a professor at the Dalla Lana School of Public Health at the University of Toronto. Dr. Gignac's research expertise is in the areas of health and social psychology, and her research examines psychosocial factors like stress, coping, and adaptation, and their importance in understanding the impact of chronic, episodic conditions on the lives of adults across the life course. With that, I will hand it over to Dr. Gignac. Thank you for being here.
Okay, thanks so much, Melissa. As Melissa mentioned, I'd like to talk about some early evaluation work of this Job Demands and Accommodation Planning Tool, or JDAPT, which is really aimed at providing some practical support and accommodation planning. As part of the research, we call ourselves ACED, Accommodating and Communicating about Episodic Disabilities. You see a lot of names here. We have, this is a big partnership grant. We have a lot of different research expertise, physical therapy, ergonomics, clinical psychology, epidemiology, occupational medicine. So a lot of people with different types of expertise. We've also been very pleased at the partnership support that we've had. We have various community groups who participate, and I want to acknowledge Realize Canada, who has been a partner from the beginning, and particularly Tammy Yates, Raja Dure, and Melissa Egan, who have been real champions for the research. We also have an expert advisory committee of people with lived experience. And we have received funding from two of Canada's three federal granting agencies, SSHRC, the Social Sciences and Humanities Research Council of Canada, and the Canadian Institutes of Health Research. Okay, so let me just set the stage. What I'd like to do is just give you a little bit of background and then talk about the JDAPT, what it is, and then I'll move into the evaluation. So some of the challenges in working with an episodic condition are understandably that the changing, often unpredictable, and often invisible nature of many episodic disabilities creates a challenge in, first of all, communication. Should I disclose? And protecting privacy. And it also creates challenges for support and accommodation provision. Now, we had a really great keynote from Tracy Aaron-Smith, who talked about storytelling. When you look at the research, you do get a different picture. Across many Canadian surveys of about 3,400 people, anywhere from a quarter to nearly half of people will say they have not shared any information about their health limitations at work with a supervisor. More people will have told a coworker. Even fewer people will have talked to human resources or disability managers or a union. So a lot of people do not want to share any information at work, but they may still need support. So the bottom lines for us for this research is we knew that workers wanted guidance on whether to communicate, how to get support if they didn't want to share information, and what to share. We know from research that workplace professionals are wanting something transparent and consistent and comprehensive to help when they know they're dealing also with very individualized worker needs. And everybody would like some practical support and accommodation ideas. So we have been developing a toolkit at ACE. You have a link at the top of the page. It will appear on a number of slides. Essentially, we've been trying to develop some new resources to address the two big questions that we hear from people. Should I say something? And what can I do? So to address the should I say something piece, the decision about whether to share, we've created something called Decide. This is being programmed right now. It will be available in a couple of months. I can answer questions about it, but just to let you know that's coming. We've also created some resources to address the what can I do? And this is the job demands and accommodation planning tool that I'm going to talk about today. We had a number of goals when we started to create this tool. One of them was to take much more of a prevention and support approach, help people to be more proactive, less crisis focused, which is what we see. People waiting until there's a problem and then trying to do something about it. We knew that our tool would have to integrate with existing workplace support processes, so we wanted something that would enhance that. We wanted to be able to provide practical supports, be relevant to different jobs, types of conditions. We wanted to be able to promote discussion and brainstorming. No one tool will be able to have every nuance for every job and situation. At the end of the day, we want life to be better. We want work to be better for people living with episodic disabilities. And we wanted a tool that would be interactive and accessible and protect privacy. So the JDAPT focuses on work demands that may be challenging at times or regularly. It doesn't focus on what the health or disability diagnosis is or the symptoms. It guides a person through a series of simple questions about what their job tasks are and their working conditions. And any area that is challenging, it provides a personalized list of support ideas that are relevant to those challenges. And we hope this will help generate some solutions that can work for a person's needs. It can be used on one's own, so it can keep it to oneself, or it can be used to discuss support needs with others. Back in 2022, we entered the prototype of the tool into an inclusive design challenge aimed at support at work. The prototype was the grand prize winner, which was wonderful. And we've been working to enhance it ever since. So the tool itself, there are 24 different types of job demands and working conditions that we ask about. They're organized into 4 areas. So there are questions about the physical demands of work, cognitive or thinking demands, working with others, and working conditions. We have 3 versions of the tool. So there's a version that a worker can fill out for themselves. There's a version that an organizational person, like a supervisor or HR or disability manager, can complete, thinking about a particular worker. They have someone in mind. And then there's a version we were asked to create where there's no worker in mind, but organizations were saying they wanted to make work more accessible. So it allows you to think through what the job is all about. So I'll talk about the worker version and the version that an organization can fill out that are thinking about a worker. For each of the 24 demands, people are asked, is this an important part of the job? If they say no, they move to the next question. If they say, yes, this is a part of my job, or this is a part of this person's job, they're asked, is the person or are you having difficulty due to your health? And then you're also asked, does this change over time or is it fairly constant? Once a person has finished, they get a personalized report, and any area that is difficult, they're given some strategies to think about. And people can save all of this in a PDF. I'm going to go through just some screenshots. I'm not going to talk about what's on the screen in any detail, but once you open the tool, you have a choice of which of the versions you want, the worker version or an organizational version. All of the versions are available in English and French. You would then be taken to an introduction page that explains how the tool works, why we think it helps, what it isn't. It doesn't provide legal advice. It doesn't provide treatment, and you'll be given some instructions. These are two screenshots. Again, I'm not going to go through them, but this is a screenshot of the cognitive demands page. There are different types of tasks listed. You can click on it and open up examples to understand what we mean. And you work through answering the same three questions. Is this important to your job? Are you having difficulties? Does this change? You can save a draft. On the bottom there, on the left side, you can see save a draft and come back to it later if you don't finish. But once you have finished and you submit your responses, you do need to save everything, because we don't save anything on the website to keep it private. These are, again, two different screenshots. On the left, and I just want you to notice that there is a big 16 of 24. So this fictitious person said that of those 24 job demands, 16 of them were relevant to their work. And then there's some bubbles on the right. There's 8 of 16 at the top. Of the 16 job demands relevant to this person, they are having difficulty with 8 of them. And 7 of them change. So they're not always difficult. They're having difficulty some of the time. And the other bubbles just break it down into the different domains. This is not what it looks like, but if you said that physical endurance or stamina was an important part of your job, and that's on the far left, and you were having difficulty with it, you would get a number of different strategies to think about. Things you can try on your own, things you could try at work. Maybe you can do them on your own. Maybe you have to ask permission, and some more formal accommodations. For every single one of them, they will open up into more concrete examples so that you can, again, brainstorm. If it's not perfect for you, maybe there's something you think about as you're reading this that will work. This slide changes the demand. Now it's concentrating for long periods, but you can see there's still things you can do on your own, adjustments you can try, and formal accommodations. There's a lot of strategies. So if not all of them are relevant, you can click on the ones that make sense most for you and create a personalized list of the different strategies. So that's very quickly and generally the tool itself. We've been looking at who's been using the tool, and we've done some studies to understand it. We've been doing this all the way through. So before we even developed the tool, we did a needs assessment to look at what was out there. And see that there really is a gap here that we can fill. We've done 2 different evaluation studies. One is one we did early on. It's called a formative evaluation. And one is an outcome effectiveness evaluation. And we want to do more studies going forward to see how the tool is implemented. But I'll just talk a little bit about what we're seeing. In the early evaluation, we basically sat down with people and did very in-depth interviews with them. We had 46 workers with different physical and mental health conditions, 23 organizational representatives, like a supervisor or a disability manager, and they came from diverse organizations. We went through every single question. So this is very labor intensive. Does the question make sense? Is it relevant? Are the examples okay? So we were looking to see how comprehensive was the tool. Did people easily understand it? Did they feel it was relevant, and so on? And we were hoping that we would have at least 70% of participants say, yes, this was easy to understand, or yes, it's relevant for me. In fact, we had more than 75% of people, and often over 90% of the sample, said that the tool was very good on all of the categories that I've just mentioned. The one exception was comprehensiveness. We were right at the 70% mark for that. We added 3 new questions based on our conversations with participants. So earlier it was 21 items, now it's 24. And so these are just some quotes. It seemed like you covered every piece, whether it was the physical piece, tedious work that's happening over and over again, or working long hours, traveling. So you have covered everything. And that's a baker living with ADHD and a skin condition. There were basically all of them that I go through in my job. It's basically everything I do at work. And that was a truck driver living with Crohn's disease. And someone said, I go in and just say, I'm dealing with a mental illness. And my boss says, what do you need? And I say, I don't know. I think the JDAPT might be better to help me understand, actually, these three aspects of the job are what actually are difficult for me. So let's think about what we do with those. And that was a government worker living with depression and PTSD. These are very representative of the types of quotes we heard. You can imagine I chose them because they're very different jobs and very different types of conditions. So we were pleased that there was something that a lot of people were able to find in the tool. We've also done something called longitudinal evaluation. And so that means we followed people over time. In this case, we had 3 time points. When we first had our sample, they had not seen the JDAPT. We collected a lot of information from them about their health, the types of jobs they were working in and how it was going, and who they were. A couple of days after they finished that, we sent them the link to the JDAPT. They filled it out and they told us what they thought. 3 months later, we went back to them and we said, are you using the JDAPT? Is it helpful? And we got we got that same information about their work, but how's it going now? 6 months after that, or 9 months from the beginning of the study, we did the same thing. We went back to them, are you using the JDAPT and how's it going? We had here in the study people with physical or mental health conditions. Many people had more than one condition. We started with 269 people, and over the 9 months, we kept about 70% of them in the study. We had 188, which is terrific. Often you lose more than 50% of people in doing studies like this, particularly if people have a number of health conditions. So what did we hear from them? We asked about how easy the tool was to understand and complete. You could say not at all or somewhat or extremely. We had 84% of people say it was extremely easy to understand and extremely easy to complete. Only 1% of the sample said it wasn't relevant to their job, and only 3% said it was too long. When we asked about using the tool, not surprisingly, most people wanted to use it outside of work. Again, many people don't want others to know in the workplace that they're living with a health condition. And so we understood that that was what we would expect. We had over 70% of people at time 2 and time 3 said, yes, I'm using the tool outside of work. We had nearly 60% said they used it at work. This dropped at time 3 to 43%. I'll come back to that in a minute. And we were actually pleased that we had 21% of people said they shared the tool itself at work with others. And that rose to nearly a quarter of people at time 3. So why did some people not use the tool? When we asked them, these were the 2 top reasons. First of all, not surprisingly, with an episodic condition, we had a number of people, 40% at time 2 and 46% at time 3, said, my health isn't currently impacting work. I don't need it right now, but it's great to have it. We had people who said, well, I got some strategies the last time, and so now I'm using them. I don't need anything new. I found what I need. So 49% of people said they already had strategies and 46% at time 3. So we think that explains some of the drop we saw at time 3. We had, though still over a quarter of people said at time 2, I am concerned about asking for help. It dropped to 18% at time 3. That's of interest to us. We don't know if the tool was helpful in making people feel more confident about asking for help. That's something we'll try to find out more about later. And only fewer than 2% of people said no JDAP suggestions fit their job. So that was also important. Again, just some quotes. It was empowering to see how much one can do on one's own, especially when I'm hesitant about being supported by HR. I use both the full and my personalized list of strategies and accommodations when I was informed that I would need to return to working in the office some days. The suggestions in the materials were very helpful. I used the list of strategies and accommodation plans, plus the language of the job demand summary to help me request a workplace accommodations plan. These tools were critical in helping me explain how my disability impacts my work and allowed me to think about possible solutions. The plan is still being finalized. Without the JDAP, I wouldn't have had the confidence to go through this intimidating process and advocate for myself in such an effective way. Again, these are the kinds of comments that were quite representative. I want to say that we were pleased at how people felt that the tool helped them to talk about something. They didn't want to talk about their diagnosis. They could focus on job demands. So just to finish up here, I mentioned we gave a survey to people before they saw the JDAP, and we gave the same survey to them at every time point. We wanted to see about changes at work. So we had a number of questions, about 20 questions that focused on something called self-efficacy, which is just how confident are you that you can do certain things. In this case, we asked a number of questions about how confident are you that you can solve problems related to your work and health, that you can meet your job demands, and that you can meet your emotional needs, like dealing with stress and worries about the future. We asked how much difficulty people thought they might have getting, or how much difficulty they were having getting work done, work productivity problems, and we asked about absenteeism. When we looked at people before they ever saw the JDAP and at 3 months, and then before they saw the JDAP and at 9 months, we saw positive changes in the direction that we had hoped for. All of these were highly significant, statistically significant at 0.001. So not likely to be chance. In other words, people felt more confident that they could solve problems, meet their job demands, meet their own emotional needs. They were having fewer difficulties getting as much work done as others expected, fewer work productivity problems, and they were absent less often. Now, those, as I said, were statistically significant, but were they meaningful? In other words, they can be a real change, but maybe not a big change. So you can do something called effect sizes. When you have a number around 0.2, it's a small change. It's there, but maybe not a big thing that you'd see. 0.5, that's a more moderate change. That's a bigger change we'd likely notice. And 0.8 is a very large change. We don't usually see that in rehabilitation kinds of interventions. You see that more with a big surgical process. But what you can see here is that the absenteeism change, it's small but real. The other changes were all moderate to large, which suggests that they were meaningful, that people were noticing the change in their ability to do their work. So just to finish, we have also looked at, were there differences in gender, age, type of health condition, permanent or contract work, whether you had a union to help you or not, whether you're at a big or a smaller organization. So far, we're not seeing many differences at all, very few differences. In other words, the JDAP seems to be working well for many groups. So just to let you know again, it is freely available in English and French. Please try it out. Let us know what you think. Share it with others. We don't ask for any personal identifying information. You can download your responses, but we won't save anything from the website. We've had the worker version around for about 11 months and the other versions for about 5 or 6. We so far have had over 8,000 unique visitors to the tool itself. We've had 3,900 downloads of the PDFs. Most of the visitors, not surprising, are coming from Canada, but we've had about 2,000 from the US, UK, Australia, and a number of other countries have also been visiting the tool, which is terrific, and we really want to get it out there. So I will stop there and turn it back over to you.
Wow. Thank you so much, Monique. It's always wonderful to hear all about how this project is evolving. We've been involved for years, since I first started at Realize 5 years ago, and just witnessing how many people have used this tool and the positive feedback we hear about it, it's extraordinary. So congratulations on this wonderful work.
Well, and thank you to Realize.
I am going to just tap George on the shoulder and see how we're doing in the Q&A.
We have lots of questions for you, Monique. Have you approached the Institute of Musculoskeletal Health and Arthritis as a partner or a funder? I'm not sure if they would want to be able to be a partner. Just a thought based on the number of people with musculoskeletal health conditions and related is very high.
Yes. So we have the Arthritis Society. I sat on IMHA's committee. So we have funding from CIHR, and IMHA, I believe, was a partner in the original funding to develop the tool. But that's a good point. We should get back in touch with them again and let them know about, we would love their help in disseminating it.
Okay, next question is, thank you, Dr. Gignac. I've used the JDAP tool during the initial research phase in 2022. It was helpful. The unfortunate thing is that not all workplaces are in tune with their own accessibility policies. I believe this tool will help not only employees like me with an invisible chronic illness, but people, leaders to think outside of the box and make employment more inclusive and accessible. I would love to see this tool acknowledged and used in higher education along with the workplace.
Thank you for the comments, and thank you for trying the tool and letting us know that it was helpful. You're absolutely right. When we heard more negative comments about the tool, and there weren't a lot of them, they were entirely about the organization and its lack of readiness or openness to using the tool. We have a number of organizations. This is the way we do it, and we don't think about other things. So we've actually been devoting an awful lot of our efforts lately to try to go to organizations, larger and smaller, to try to talk about the tool. It's not going to replace anyone. It's meant to enhance what's already there and start everyone at a level playing field. And so that is a really important goal for us. So thank you for raising that issue.
And the next question is whether or how someone should disclose their functional limitations raises important legal considerations. Employers have a duty to inquire if they suspect or have reason to suspect that an employee needs accommodation. Employers and workers have corresponding duties triggered by a request for accommodation. Does the ACE tool include any legal information to help people understand their rights and responsibilities in this process? Or does it at least inform them about resources they should consult for more information?
Yes, thank you. So the new tool we are creating that is a decision support tool, it walks you through the different things you need to think about before you make a decision to disclose. So that tool is meant to be a companion to the one I talked about today, the JDAP. And that, as I said, will come out in the next month or two. It's very close. It will give people the things to think about. It will help you understand where you are. And then, yes, we link it to other resources. So we link it to information, human rights information about duty to inquire, duty to accommodate. What do we mean by undue hardship? It's not, we don't provide legal advice. We're not equipped and experts to do that. I think you have some people coming after who will be talking more about those issues. But the tool, we try to provide people with some avenues to pursue more information so it can be better able to suit their needs.
Thank you. This is great, yet folks with disabilities I know have the answers and solutions for their own accommodations. The biggest barriers are the inabilities of companies and basic capitalism to adapt to us. I can't work full-time Monday to Friday, 9 to 5. So that limits entirely all positions open to me. how do I negotiate with an employer if I can't do a full-time gig yet still want to work?
Those are very good points, and I don't have the answers for you, but I will say that I think with the aging of the population, what we've been hearing when we've spoken to workplaces, that more and more of them are recognizing that the world of work is changing. Work scheduling, work demands, where we do work, how we try to be supportive of people. So I think it is a time of change. It is not a perfect time at all. But employers have been losing good people. And one of the things, I guess, maybe that was, I don't want to say positive about COVID, but it did mean that we were better able to embrace technology, hybrid work, different kinds of ways of working. And now employers have some evidence that, yeah, we can do it. And so I think it will take all of us, and it's going to take time, but it is a time of more positive change than I think we would have seen 10 years ago.
Okay. And has the JDAP tool been presented to the CPHR Canada groups? If yes, what was the results?
So I'll say no. Partly, I'm sorry, I don't know what the acronym is, CPHR. Canadian, does someone know? I will say we have been presenting to the Canadian, we have had conversations with different departments in the federal public service. We have had conversations with some Ontario ministry and workplace safety groups. And we have talked to a number of different professional groups, disability managers, occupational physicians. We've talked to large financial organizations about using the tool. So we're getting it out there. But the bigger the organization, the more monolithic it is to change. So they want information from us, and it's going well, about how we protect the site and all the rest of it, those things. And we're providing them what they need. So hopefully there will be more awareness with a number of large groups.
Okay, and I'll pick just one final question. Is there anyone we can turn to from the organization or elsewhere if we have used the JDAP tool to prepare a reasonable workplace accommodation request along with our healthcare provider, and with our request is denied by our employer?
Yeah, so that's starting to get more into a very individual person's need. I would speak to healthcare professionals and bring the tool to them. There are sometimes disability service providers, and of course there are labor lawyers who are available. Our group is really a group of researchers, so we're not really equipped to be able to advise or help people, I think, in the way they would need, particularly if a request has been denied, to kind of review that. But I would speak again to healthcare professionals for some help. If you have a union, obviously, even HR sometimes can have people who they can keep information confidential. And I'm sorry, there may be others who have some suggestions of where you can go for some of this kind of advice. I apologize, I don't.
Yeah, and there is someone in the chat. So I'm going to pass it back to you, Melissa, to go on.
Thank you so much, George. Thanks, everyone, for all of your questions. And thank you very much to Dr. Gignac for being here and sharing the JDAP research results and evaluations, and just really how exciting and useful this tool has been over the last few years.
Thanks, Melissa.